Assalamu alaikum. The paper for today is rubber dam clamp may cause cortical necrosis. It's a case report done by Raymond, 2023 by Joy. It is well established that rubber dam use reduces microbial contamination and decreases a patient's potential for ingesting or inhaling instrumentation's chemical or foreign bodies. A stainless steel rubber dam clamp used in the application of the rubber dam is commonly required and is the source of disadvantages, including gingival injury, which can be evaluated on intraoral inspection and usually resolved without intervention. What is not easily evaluated or previously published in the literature is the effect of rubber dam clamp has on underlying bone in otherwise healthy patients. This case presents the scenario of a rubber dam clamp used during an endodontic procedure causing necrosis of the cortical bone and sequestrum formation, with the CBCT imaging further demonstrating the underlying bony changes. 22 years old, otherwise healthy patients complaining of recent onset swelling preceded by lower right jaw pain of 8 out of 10 intensity for a duration of 2 weeks. Upon vitality testing and radiographic evaluation, the tooth diagnosed with symptomatic irreversible pulpitis and periapical periodontitis, which is tooth number 31. In that date, the pulpectomy was performed and painkiller was prescribed. The patient was then referred to an endodontist for completion of the root canal therapy. 4 days later, the patient was seen by the endodontist and obturation was done, and the patient was referred back to the general dentist for cuspal coverage and restoration. 7 days later, the patient returned to the general dentist presented with inflamed lingual gingiva that would prevent adequate margin access, so the provider delayed the final restoration for 4 weeks until the inflammation subsided. Then amalgam was placed. 20 days later, the patient presented to the general dentist with a complaint of 3 days of low-grade pain intensity and pressure-like feeling with a swelling near the tooth number 31, for which she was taking painkiller. The clinical examination revealed localized swelling with purulent drainage on the mid-root region lingual to the tooth number 31. Periapical radiographs were obtained and interpreted as having mesial and distal root lucences. Tooth number 31 was diagnosed as previously treated with chronic periapical abscess, and the patient opted for incision and drainage with endodontic consultation. Antibiotic was then prescribed. CBCT imaging was ordered, and the patient was scheduled for re-evaluation with the endodontist. Basically, 3 weeks later, the radiologist's description of the CBCT imaging was as follows. For tooth number 31 is endodontically treated with a normal periapical appearance, and the adjacent lingual cortical bone has a lytic and erosive appearance spanning approximately 16 mm in anterior-posterior dimension times 7 mm craniocaudally, that is limited to the thickness of the lingual cortex. Then the general dentist consulted an oral and maxillofacial surgeon and advised to return to the treating dentist for CBCT review. 5 days later, the patient returned to the dentist complaining of sensitivity and biting, tenderness in the lower right jaw, and the clinical examination revealed that tooth number 30 was responsive but lingering to the cold test. The originally treating endodontist review of the CBCT imaging in addition to the radiologist finding. So they diagnosed the tooth number 30 with the symptomatic irreversible pulpitis. Then the endodontist assured the general dentist that the patient was experiencing an iatrogenic injury from the rubber dam clamp or potentially embedded oral seal putty. Then Continued follow-up by the general dentist over the following month showed resolution of the patient's symptoms with no recurrent swelling or foreign bodies exfoliation from the lingual region, and 6-month follow-up and CBCT acquisition revealed normal lingual cortical bone in the area of the previous concern. So basically, the significance of this paper is when stainless steel rubber dam clamp is placed into mandibular bone, bony changes can occur, resulting in necrosis of the bone. Knowledge of these improve our understanding of a normal course after dental procedure using rubber dam clamp. Thank you.